Now, there's growing resentment among caregivers at the Komfanochi Teaching Hospital over the management of COVID-19 cases at the facility. 8 confirmed cases have been recorded at the Child Health Directorate in the last few weeks, with the caregivers accusing management of putting their lives at risk as suspected coronavirus cases are managed alongside regular patients. Ohiming Terry has more in the following report.
Doctors and nurses at the Komfanochi Teaching Hospital's Child Health Directorate say there's no concerted effort by management to either test staff who come into contact with COVID-19 cases or close down wards for fumigation.
We have been told that we cannot refuse care to anybody. So I think our facilities are doing their best not to return anybody who walks into the facility being ill. And by so doing, they are also increasing the exposure rates of every other person around. It's been almost a week now, but nobody has been called or contacted about testing the staff nor the relatives. A lot of us are embittered by it. We keep complaining, we keep passing comments. But I mean, we can only talk in the background. If there is anything that can be done, it is about management helping us out.
A nurse who spoke on condition of anonymity says the over 400 caregivers are compelled to work without the right protective gear. She says the development puts their immediate families and that of the public at risk.
There has been a clear line in that we should have frontline health workers who have been trained specifically for the management of COVID-19. But as it stands, it looks like every health worker is capable of managing COVID-19 at any little space on the ward, which is not supposed to be so. It exposes both the patient, the health workers, as well as the relatives who come around these patients. And it makes managing COVID-19 quite difficult because we know that COVID-19 should be managed, 1, in an isolation, 2, by trained professionals, and 3, with specific PPEs. And all these 3 things are being lacked. We initially had suspected, and getting results was a problem. Finally, when they became confirmed, we had to manage them on the ward because, as we are being told, there is currently no trained personnel and no specific place to keep those patients. So they were being managed on the ward. When in the first place, we don't even have social distancing on the ward because the wards are full. We had to manage these patients side by side with the average normal sick patients.
According to her, caregivers are appalled by the failure of management of the hospital to close down affected wards for fumigation.
Ideally, the ward should have even been closed down by now. Once we got to know that there was a patient who had been on the ward and the exposure was to virtually every nurse and doctor, because for 3 weeks, every nurse would have had contact with the patient so that these nurses could have been given an isolation plan at home with prophylaxis. And then, if possible, each nurse should be tested. And then based on the test, we would know who can return to work and who needs to stay home. Since we've had an increasing number of 8 in just 2 weeks, the probability that we may record more in no time was possible, and so we should be prepared for it. It's quite traumatizing and scary.
Management of Komfanochi Teaching Hospital has expressed concerns over the issues raised and promised to respond at the appropriate time. From Kumasi, for Joy News, Ohiming Terry reporting.
Now, throughout this pandemic, the use of high-concentration alcohol in hand sanitizers has been strongly recommended. But as cases of the virus begins to increase in Ghana, a university professor says the inclusion of hydrogen peroxide in the management of the virus could potentially save many lives. A number of health professionals have agreed with this study. Here's how to use hydrogen peroxide, as Reverend Professor Kwame Nasego said on the AM show earlier.
So what we're recommending is that 3% is harsh. What we're recommending is for you to use just 1% to gargle. 1% meaning that if you take one part of the hydrogen. Most of the bottles on the counters are 6%. So if you take one part of it, you add 5 parts of water. So let me make it simple. If you take 10 mils of hydrogen peroxide, you want to add 50 mils